Hi, it's about 2 p.m. on July 10th. It's Friday afternoon. Oklahoma City, Oklahoma. Noel Williams, Dr. Noel Williams, Optimal Health Associates. Hey, how about that big rain in Oklahoma City this morning? That was quite the storm. Uh, I think it's resulted in massive static. My hair's a mess, but that's okay. Just got off the phone conference call with the Central Oklahoma Interhospital Task Force on COVID. We are a group that had been meeting starting in February, met a lot in March and April, and then abated in May. Unfortunately, we reactivated and had a conference call today due to the massive number of infections, the significant hospitalization numbers, and all the systems in central Oklahoma being tested, as they are all over the state. So a really good meeting today, which I'm going to report on to everyone. We had a new person. So it's, for those of you who haven't been aware of this committee that, or task force, it's OU, Integris, Mercy, St. Anthony's system, Midwest City, Norman, and then we had Dr. Mishner, Chief Medical Officer from Lawton Hospital, join us today. Quite a funny guy, very insightful. A joy to have him with us. We'll have the new president of Integris, we hope, joining us. She had a conflict today, and once she joins, that will be exciting. We already have several Integris people, so we always want more. The more minds chatting is wonderful. So the thing I think the person from Lawton discovered was we're all in this together. It's always novel. He had had some concerns about how they were dealing with COVID and just in terms of managing, communicating, and things, and discovered we're all having the same thing. And so that's one of the nice things about the task force. We help each other realize what is going on, and maybe you may think you're having a problem in one hospital system, and lo and behold, you're the same problem somewhere else. Likewise, all of us have had testing issues in terms of getting enough tests done. And Dr. Ruskowski and the Integris people had the idea of, well, working with DLO and doing pooled testing, which means that instead of running an individual test on every person, which is what we've been doing. So in most of the hospital systems, the return rate on doing an individual test on everyone is like 0.25% for positivity. So you're going to do 400 tests to find one. Maybe doing pooled testing where you can take 10 specimens, all run them together. You keep them separate, but you run them together. And so if that test is negative, it means the whole group's negative. So you can then, instead of using 10 tests, use one test. And when you start multiplying that out across vast numbers of people, it's going to save, thousands of tests a week, tens of thousands of tests a week. And what happens if that group test is positive, then you run individuals on the 10 people who are in it to figure out who was positive. And so those are the kind of ideas when you're have all these really smart people in different settings who aren't communicating. You get them together to communicate, great things can happen. And that's what the public health service is supposed to be doing. And those are the things you get trained to help facilitate. But again, that isn't happening that much in the rest of the country or in a lot of places, but be that as it may. So we had a really good idea from that. Really good news. There's not been really much in the way of childhood infections in the state of Oklahoma, virtually at all. There's been no admissions essentially at children. There's not been anyone with a catastrophic Kawasaki disease, which makes sense. And there hasn't really been any documented cases of children to transmitting to adults that we know of. Now, sure, there has been, but again, there isn't this huge thing going on with kids, which is great for school reopening. Kids aren't really, again, they're not getting it, they're not getting sick, and they don't transmit it. But the issue is they can transmit it. They don't transmit it very often, but they can. And now that we're having this huge explosion of cases, and the other thing we know from just having this meeting, and which we already knew, but it's obvious, everybody's pretty saturated at the hospital level. There's not this huge number of beds available. We're virtually we're at zero. We're basically going into an overflow state. So we have to do things to prevent hospitalization, and the one way of preventing hospitalization is not to get people sick. So there's an intervention we can do, which makes people get mad, and they think it doesn't work, but it does work, and it's wearing masks. And so I'm going to give you some statistics on masks. The first and foremost thing to know about masks is they work. If we keep on doing what we're doing, the predicted number of deaths from COVID between now and October 1st, and that's before it's going to pick up even more, is 42,000 people in the United States. If we all universally adopted masks today, it means kids basically 3 and older, it drops to 17,000. We saved 25,000 lives. It's a big number. And so then if we think about school reopening, like I still have this lady that I saw being interviewed from Florida who was head of the teachers union, who to me was an idiot, because she's like, we can't open schools. You got to understand the science. You can't open schools. We just have to protect the teachers. We have to protect the teachers. So if you want your kid's school to open, and I'm pointing at you, the kids have to wear masks. The teachers have to wear masks, obviously, but the kids have to wear masks. I'm sorry, you can't put the teachers at risk, or the school administrators, or the cleaning staff, or the food people. And there's so many of us that if we all wear masks, we are going to impact some infections, even when it's children. And so that's how we open up schools. And if we can open up schools, it also means we can have football season. And we can have all these other things potentially. But if we don't universally adopt masks, we can't open schools. And we can't have football seasons. And the reason I point out football is there's a lot of people who like football, but it would be nice to be able to have a football season. It would be nice for the colleges to open. It would be nice for kids to go back to school. The American Academy of Pediatrics said, the president said, that if we don't get schools reopened, the suicide rates are going to skyrocket. Again, it's true. It's true. We know suicide has really, really gone up since all the lockdown. And if kids don't get back in school, don't have socialization, aren't getting the food they need, which a lot of kids get major food sourcing at school, it's going to be a disaster. 2 days a week's stupid. The New York governor saying that, or the mayor, don't even do it if you're going to do 2. The kids aren't going to get sick, and it's very low risk for the teachers, but you can do it and engage them and teach them and still move them forward and socialize them. But it requires masks, and it requires policies and thought. But the whimsical and arbitrary, we'll do 2 days and not the rest, that doesn't make sense. So that's one of the take-home messages today. Kids are going to need to wear masks. They need to wear masks when they go out. We have to adopt this more universal precaution concept. As frustrating as that is to you, it's how it is. And I don't need you to be like the people who come into our building at where I have an office, Optimal Health Associates, and where the people who share the building, the orthopedic group there, where we've now had to bring a police officer and hire a police officer to be in the front of the building as people come in to have their temperatures taken, because people have gotten so violent for just having their temperatures taken and thrown clipboards at the staff and sworn at people and said horrible things. And that's totally unnecessary. Go with the flow on COVID. We're being safe. People are being safe. We have to adapt to what's going on with COVID in our communities. And unfortunately, it's skyrocketing again. People really do die from it. And we have to deal with it without being uncivilized, unpleasant, swearing at people, becoming violent. But how awful is that at doctors' offices across the country and at physician buildings, they're having to hire police officers to be at the front because there is a significant proportion, even though it's a minority, of people who misbehave that badly, and it's scaring and intimidating the staff. So think about that. If everyone who's kind of science-based is telling you that this could be a good idea, it's probably a good idea. If it's not, in the end, if we're all wrong about it, it won't have harmed you to have worn a mask. But we already know it's true because there's data from SARS and MERS, not MERS, but from SARS-1 showing the benefits. It's all been modeled. So that's just stuff to know. Now, if we think about preventive strategies moving forward, and I'm going to be coming back to this whole mask thing because it's essential for children to wear them at school to protect the adults. It's not to protect them from each other, it's to protect the adults. The adults need protection. So I'm just going to harp on it every day probably from now on. If we think about elderberry, if you start getting the sniffles, cough, cold, congestion, anything virus, always pulse your zinc. Elderberry, you just get elderberry lozenges and start sucking on them all day. There's some really good data that elderberry is super inhibitive to colds and influenza viruses. There's another receptor besides the ACE2 receptor that COVID binds to, and it's like L203C1 or something. Well, it turns out that elderberry has a tendency to block that receptor in your respiratory tree. And so that's why it can work to stop viruses. Well, it's the other co-receptor that COVID binds to, which is why the journal article, which I've posted several times, goes through all this data on elderberry and why it's beneficial. So you just suck on elderberry lozenges the second you start getting cough, cold, congestion, and you just suck on them, or you can do a teaspoon of elderberry syrup, 3 or 4 times a day. It's something that can contribute to your immune system, fight the virus, and it's harmless. And that's one of the messages from the doctors who wrote this paper, harmless interventions. The other one to think about is using a little betadine solution and gargling with it daily, and especially if you start getting cough, cold, congestion, that will work. Mouthwashes, you can do, scope. I mean, that kills viruses too, but providine iodine or betadine, and if you have that, taking a little swab into your nose, up the nose, that will also help. Again, simple solutions. One of the other things we've talked about for prevention is doing nasal rinses on a persistent basis. That gets the mucosal surfaces in the nose really tuned up to fight infection and makes it harder for infections to occur. So that's all the kind of stuff we have to start thinking about. But part of being in society is being in society and helping society. We don't want to go backwards and have to shut everything completely down. One, I don't think it's going to help at this point. And then there's no reason to do it. The second thing we need to focus on is how do we communicate? And this is something all of us can think about, and you can write me. How do we get the 18 to 32 to 34-year-olds to listen on this? That's what we were talking about in our conference call today. You'll start seeing doctors on TV again in the next week, and a whole bunch of media stuff, because that's what I'm going to help coordinate getting all these really smart doctors on TV. But one of the things one of the physicians brought up is, how do we get these 30-somethings or someone 27 to realize that they need to wear a mask too, and they need to be careful too, because while they may get it and only get mildly ill or moderately ill, very rarely would they go into the hospital, they can give the virus to, again, people who then get very, very, very sick. So how do we communicate with them or get that message to them? And I think it's going to take all of us. It's going to take everyone who listens to me. It's going to take public messaging. We have to get this age group of 18 to 35 to 40 to understand you may not die from this if you get it, but you could give it to someone who could die from it. And we have to get the whole group wearing masks to help us. And again, it's all about saving lives, and that's what we're trying to do. So that's the update for today. I don't have anything else other than have a great weekend. I may have a guest person in the next day or two if we're lucky, but we'll go from there. Take care and have a great